Anybody want to jump in with a fun fact?
Oh, come on.
Okay, Ellen, I'll start. Let's see here. Something that I actually, the fun fact about me is that I immigrated to this country in 1977. Tells you a little bit about my age, but I didn't speak a word of English.
Oh, wow. I would never have thought that.
So, fun fact.
So what's the native language?
It's Farsi. It's a Persian or Iranian. I spoke fluent Farsi, but I didn't even know, not even the basics. And my parents put me in school and said, go learn.
Yeah. Well, I wouldn't have no accent at all. So,
Yeah.
Yeah.
Been a lot of years.
Well, I don't know if that's a fun fact. I'm a native Floridian. I don't know if anybody else is, but I grew up in
So that is a fun fact.
and I'm one of the rare ones. So
Awesome.
any other fun facts out there?
What can I say?
I can say I'm really glad I'm in Florida. I lived in Alaska for 30 years.
Oh my gosh.
Wow.
Love the weather.
Gosh.
I did live in Hawaii for a few years too before I came down here, but I got to tell you, I love Florida weather.
All right.
Florida weather is
You like Florida
now.
better than Hawaii. We can say better than Hawaii, right? All right.
Yes.
So, okay.
Fun fact.
Well, I think we've got everybody in. David, you don't have a fun fact about
I
yourself?
do. My index finger is longer than my middle finger.
Oh.
I'm just teasing. My fun fact.
Okay.
Physical anomalies.
This is my favorite pen. That's
Oh, that is a
Simon.
fun fact.
A fun fact.
All right, Simon. We have Misti Oxford-Pickeral is here from CCAOM. She's the president. So we have both NCCAOM and here to answer questions. And Mina has a little presentation we'll let her start with. Olga Cox is also here from NCCAOM. Mina, I'm going to let you take it away.
Sure. Olga, do you want to do the slide share or do you want me to do it for the presentation? Olga? Okay, I guess I will start then. Let me go ahead and share my screen here.
Okay, if everybody
we'll get
can
things
mute
started.
unless you need to talk, that will cut down on background noise.
All right, can everybody see my screen? Let me get rid of this here. Okay. Can everybody see my screen, the slide presentation?
I see it.
Okay, great. Okay, we will get started here. So I'm gonna go ahead and go through some of these slides quickly because I want to be really succinct and crisp with the presentation so we have time for questions. So again, I'm Mina Larson. I'm the Chief Executive Officer for the NCCAOM. I'm here to give you some updates and information about how NCCAOM is there to be able to provide resources to you during this difficult time and some of the policies and procedural changes that we've had since COVID has hit us. We're really looking at everything on how we conduct our business to be able to help our applicants, candidates, students, PDA providers, and of course our diplomates. Of course, we do have NCCA, the National Commission for Certifying agencies that we have, that's our accrediting body. We have to look at them in order to be able to make any substantial changes. But again, here's our mission. I think you all know our mission. I always want to remind everybody that our most important stakeholder is the public, because NCCAOM is a credentialing organization, because we measure competency. So we really want to make sure public safety is a big part of what we do. We do a lot of different work to promote and advance the profession, but again, the public is very important for us, and that's where our exams fall in. There's a big reliance on the states in terms of the Acupuncture Board in Florida, the Florida Acupuncture Board, and NCCAOM work together to make sure that your licensure verification and all that information is submitted to them so that you can practice. Again, we are one of the requirements for licensure in order to be able to practice in the state of Florida. We have a professional ethics and disciplinary review committee for those who violate that. They have to be, we have a committee that reviews that, and we can get sanctioned. And we also work closely with Florida Acupuncture Board in making sure that information is shared so that they know about our sanctions, we know about theirs. And of course, we have the maintenance continued competencies through recertification for ensuring that you continue your certification requirements. Again, we've been doing a lot of work lately on federal advocacy. Our office used to be in Jacksonville, Florida, which was wonderful because I got a chance to come to Florida a lot and I miss it. But now our office is in DC. What we've done is we've streamlined our services to work with association management company. We have shared space. We have staff there in DC. And then of course, we still have our wonderful staff in Florida that continue to work with us. But what's really that's done for us is it's allowed us to use some of that money for operations to really be able to do some federal advocacy work, hiring federal lobbyists to be able to promote qualifications for our practitioners. The work that we've done with the VA. The VA now can hire licensed acupuncturists. The CMS, you've all heard about what's happening with CMS. Really, and again, we do that with partnership with national organizations such as the ASA, who's done tremendous work in that area, as well as our state associations with FOSOMA. We've been really working with FOSOMA and helping them as long as I can remember. We started coming to the FOSOMA conferences years and years ago, and we consider FOSOMA a wonderful, strong organization that's continued to really be there for their members. So we're proud to continue that. And of course, public education, promoting the standards with public, with policymakers, with the media, all of that work we do. So really quickly to go through that, I'm not going to spend too much time on requirements for certification. A lot of this information is on our website. Our application process has completely been automated through COVID-19. Our staff is completely remote now because obviously DC shut down, but that doesn't mean that we're not shut down. We're 100% operational. Everything is online now through NCCAOM. For those of you who apply for certification, you know that it's a very much more streamlined process than it used to be. Application used to be 4 to 6 weeks. It's now 1 week in order for you to get your application review process done. So we're really proud of that work here. And then of course we have our recertification requirements. And again, that's all online. We're actually working with our AMS system to make recertification even more interactive and streamlined. So all of that is happening so that we continue to enhance that process. We really want to push this NCCM reinstatement route, particularly in Florida, because in Florida, NCCM certification is not required. You have to pass the exams. You got the 4 exams you have to pass, but you don't have to maintain your certification. So there's a lot of practitioners in Florida that don't have their NCCM certification anymore. For whatever reason, they didn't need it. They didn't want to keep up with it, whatever. It used to be that you had to take an exam in order to come back. So after 3 years of being lapsed, which basically, let's say your certification expires June 30th, 2020, after 3 years, 2023 June, you're lapsed. You become terminated. So you're lapsed for 3 years, then you become terminated. Terminated means you're no longer certified. What the policy used to be that you had to take an examination, was called a reinstatement. It's a tough exam. So since I became CEO about 8 months ago, I looked at that process and I worked with our accrediting body to create a route. It's a temporary route to allow diplomats former diplomats who want to come back by doing continuing education. You don't have to take an exam anymore. You just have to have a continuous Florida state license. You have to do the CNT review course. Very important to do that. You have to do safety, ethics, CPR, of course, background screening. All of that is done through through NCCAOM, and then the continuing education coursework, which our staff really works with you on that. They really hold your hand through the process. There's a formula done. It's actually much easier than it sounds. So if any of you, if you know anyone who used to be diplomat and want to come back for whatever reason, again, NCCAOM is now required for the VA. NCCAOM, a lot of hospitals require NCCAOM. government agencies and federal agencies recognize the importance of a national standard. Folks want to come back. A lot of cruise lines require NCCM. We want to have that pathway for people to be able to come back. So again, this route is active now. You can do it. It concludes June 2021. We're working with our accrediting body to extend that. We realize COVID's happened. Life has changed for a lot of people economically and whatnot. So we want to extend this route a little bit. So we're working with our accrediting body to do that. So stay tuned for more information on that. Next, I want to talk a little bit about some of the emergency initiatives that we've done. I've talked about that a little bit earlier. When we had our board meeting, right on the time the quarantine hit, like I want to say March 15th, 16th, I sat down with my board and I said, what can we do so that we can help our students, our candidates get through this difficulty? The first thing I can think of is exams. I thought, oh, our exam centers are going to close. That's what happened. And every single credentialing organization, whether you're a physician or a nurse, exam centers are closed. So I realized that, and I realized that we were also in a situation where we were offering the exams in a linear fashion. Linear means that you're offering the exams in windows, and so basically 2 weeks, and then 2 weeks in February, and then 2 weeks in May, and then so rather than adaptive, which is continuous, I worked with my staff and our psychometrician to move the adaptive exam to May 18th. That was a lot of work on our part where we did it. I wanted us to make sure that we offered the NCCAOM exams continuously. That was very important for me because I want our candidates to get in there and get licensed. So we did that. And again, if you are a candidate and you can actually call Pearson VUE right now and you can schedule for May. I want you to be flexible. Remember, the testing centers are open, but we have social distancing, so they're 50% capacity. They have to space everybody out. There has to be they have to be safe, and if there's particular areas that are not open, obviously there's some areas that are still experiencing high COVID numbers. But the ones that are open, that are available to you open, you can go ahead and do it. If you live in Orlando and your area is closed, you have to be flexible. You might have to travel to Tallahassee or even to Tampa or farther. You might have to go ahead and do it on a different date. Just understand and know that Pearson VUE staff they really work with you to try to get in. But I'm very excited to be able to do that. I know a lot of people are nervous about that, and they feel like, what happens if COVID hits again in the fall and in the winter and testing centers close again? So I've been really working with the staff proactively with Pearson VUE. One of the things I did is I talked to their leadership and said, how can I make the NCCAOM exams essential? It's a little bit different from practitioners being essential, but our exams be essential. Our exams are tied to licensure. It's important that we get our students and our candidates to be able to get licensed. So I really looked at every single state law and worked collectively with the states to show and demonstrate to Pearson VUE that our exams are essential. Kind of like with the nurses and the doctors and all of the other essential groups. And we were able to do that. It was a very long, difficult project, but I'm very excited to say that our exams were deemed essential. So technically, Pearson VUE is open June 1st, but guess what? We can test in May. So when COVID hits again, whenever it does, we will still be able to maintain the testing centers to be open. As long as the states allow them to open, we'll still be able to test. That was one of the best news and one of the best initiatives that we've done. I want us to make sure that we can get licensed. So another thing that we did is that we realized that students will not be able to take the exams until they have graduated because, again, we have this policy. So we really looked at this carefully with our staff and our board and said to ourselves, is there a way that we could allow students to be able to, students who have not graduated, students who are graduating before December 31st, 2020, can they actually take and sit for the exam? So we checked with our accrediting body, we sat down and looked at it, and yes, we are doing that. So if you're a student and you are going to be graduating before December 31st, you want to go ahead and talk to your school and work with your school so that your school can send a list over to us. And then if you're on that list, then we will allow you to be able to take the NCCAOM exams as a student. Remember, you cannot get certified until you actually graduate. We get that final official transcript from the school, and of course, you have to get your CNT. That's very important. The Council of Colleges sent to us, but this also gives you a little bit of a leeway or extra time to be able to get licensed. So, for example, in Florida, you have to pass those 4 exams. You could actually start doing that, while you're in school. But don't forget to get certified, because you do want to go ahead and get that done and send your graduation transcripts to us. Again, contact your school if you're interested in doing that. Also, we've done a lot of work on informing everyone about what's going on with COVID. We're really proud of our partnership with ASA. We have a COVID-19 status update page. You can go to it. There's a lot of information up there. We've communicated with our candidates. We've actually sent information to all the regulatory boards. We really are trying to get as much information out there, just like Foresee is doing a terrific job letting you all know what's going on at your state. We're trying to do that on a national level as well. So I'll go on to the next slide. So again, it's about during difficult times when things are really tough, you have to be able to step up as a leader. And as you can see, for someone has done that as a state association, we're doing that too. We're trying to find information where we feel that our applicants, students, and diplomates find useful to us. So the ASA and NCCM have done are doing a weekly town hall meeting when we're surveying our diplomates and practitioners and finding out what kind of information is important. What do you want to hear? What is the topic du jour? What's relevant? So we're working with ASA on that. They have tremendous resources. We are bringing our resources in terms of our staff to be able to partner with ASA to be able to do these town hall meetings. All that information is on our COVID-19 resources page. Every question that's asked during these town hall meetings, we actually take the time to answer every single one of them at the end and post that. A couple weeks ago, we had Misti from the Council of Colleges and Mark from ACOM there. We had a whole educational update. We're really excited about that. We have never done something like this before, and I think it's really helping get the word out and creating resources. Like, for example, the CARES Act, that's a big impact on practitioners in terms of unemployment, loans. All of this information, we really want to have a place for them to go to get that. And again, we have resources for candidates and diplomates also as well on our website. So there's a lot of information about federal student loans. I'm not going to get too much into this because I want to be able to give time for others to be able to speak. But again, this is all information that you can go to our website and find out. Loans impacting education, a lot of work that's been done through the CARES Act. There's several CARES Acts. There's another one coming out, CARES 4. We're predicting it to be in late May, early June. I'm working with my federal lobbyists to be able to get all this information and really pare it down and have it available to you. Again, visit our website for that information. And of course, the Paycheck Protection Plan, a lot of questions about that all on our website. And here's a little sample of what you can find when you get to our website, the coronavirus COVID updates. We've also put together a safety statement. A lot of people are calling us and saying, hey, we want to treat COVID. Can we treat COVID? It's a big question. So because our mission is public safety, and that's what we do, and the well-being of the public, we are not approving any professional development activity PDA courses that are intended to address the exact direct treatment of COVID-19. So if you're a provider and you send a course to us where you're saying, I'm treating COVID directly, we will not approve it. You can treat the symptoms of it, of course. And of course, we have a huge part in the recovery of it. So we just wanted to let everyone know that. ASA also has set guidelines together in a statement or a fact sheet that they have. They've done an excellent work on that. But again, this is on our website. I want people to know that because we're presenting a lot of information in our town halls. Yesterday, we had a wonderful pulmonologist, medical doctor from China who presented a lot of research information. But again, I want to emphasize the safety statement. So at this point, I'm going to turn it over to questions to see if anybody has any questions for me.
I'm trying to unmute everybody.
Sure.
So,
I just have a quick question. Do you
Sure.
foresee Pearson View opening up any additional dates? There,
Yes,
okay.
absolutely. Absolutely. So good question. So every single day. So right now I've worked out with Pearson View that any of the centers that would have been closed to others are open to us because of the essential testing. But there's some that will not be open because of safety precautions. They don't have enough PPE or they don't have enough cleaning supplies. So because of that reason, every single day, Pearson View opens up more and more test centers in the U.S. because states are reopening. You know that, right? So if you're a candidate and you are scheduling with Pearson, check back every single day. I would check several times a day, particularly if you have ADA accommodations, because I know those need special provisions. If you're having a tough time and you just kept getting kicked out, you could certainly call our office and we can help you. Pearson View is really there to be able to help you, walk you through it. But if we had a candidate recently who had ADA accommodations and she was trying to get in and she couldn't find anything until August. And that's frustrating. So in those circumstances, you can call us and we can look for you. But again, more and more test centers are opening, particularly as we're getting further and further into the summer months.
Do you know where they're most open?
The middle of the country. Because,
the middle of the country.
because like states like Utah, Arkansas haven't really been impacted by COVID. So those are all wide open. In fact, there's nine testing centers that I don't think that weren't shut down. So any of the states that really have been less impacted by COVID are open. The hot areas, of course, New York, New Jersey, Connecticut, the northeast areas are really impacted the greatest. I was really proud to be able to declare New York as an essential. I really was working hard because I wanted New York to be open, and Florida too. So you should be. So if for example, let's say you're trying to test. You live in Miami and you're being impacted because Miami isn't opening up. There's problems. Just try to look. Like I said, try to look in the vicinities. You might have to travel a little bit. Or before you didn't have to, you might have to. I've also opened up the secondary Pearson View site centers too, to be able to open more centers for you to be able to test. Be flexible, but if you see that like you can't get in for a few months, call us and see what we can do to try to help you. Pearson staff is supposed to really be able to help you. You can call. You don't have to do it online. You can either call them or you can do it online. But again, the Northeast is probably the most problematic area right now.
you might have to unmute yourself. I'm having trouble unmuting everybody. Although it looks like most people are unmuted if they want. So
I think I might have some questions in the chat. Let me see if there's anything in the chat feature.
Yeah, you have one question about taking exams before graduation.
Yes. Oh, thank you. So somebody asked about that. So how soon can we start taking our exams for graduate? So, and Olga, we have a 60-day provision. So if you are a student who is studying and you're graduating, we will accept your application 60 days before your anticipated graduation date. So if you, let's say right now it's May 6th, you have until July 6th to be able to do that. So if you're in that category, you want to immediately contact your school and let them know, and then we will work with them. They'll send us the list, and then you'll be able to test. As soon as we get that list from your school, then we will send you, you can go and apply, and we'll put you on the list to be able to take the exam.
And there's a question, Mina, that ties in with clinic hours. So
yes,
maybe it would be a good idea for me to talk a little bit about
yes, please, yes,
with ACOM
yes,
and clinic hours. Great.
Thank you, Misty. Thank
sure.
You.
Thanks. I really always appreciate hearing the updates. Ellen, is it okay if I go?
yeah, please, please.
All right, thank you. Hi, everybody. I'm Misti Oxford-Pickeral. I'm president of the Council of Colleges of Acupuncture and Oriental Medicine. And for those of you who don't know much about the Council of Colleges, I'll just share a little bit first before we kind of get into things. The mission of the Council is to support member institutions to deliver educational excellence and quality patient care. Our vision is to maximize opportunities available to graduates of member colleges to achieve their full potential in healthcare in the United States. And so that means that's our mission and vision. Our main focus is supporting our member colleges. We are a membership organization of accredited acupuncture colleges across the United States. And particularly now, as we are facing this really unexpected challenge and attempting to navigate acupuncture education during this time of stay-at-home orders and social distancing, you know, we're really supporting your colleges to come up with the best practices to get you through your education while maintaining your educational standards. As many of you might know, and member colleges across the country are kind of at different levels with that. And we have some of our member colleges that are really true trailblazers in this regard and have been exploring distance education for quite a while in their curricula. And so now is the time when we're coming together as a collective of member colleges to support each other, share our resources, share our ideas. As a council, we had a couple of Zoom calls of our membership, one with the academic and clinical deans and one for all members. And we have a resource page on our website, CCAOM.org, where schools can post ideas and best practices. So if you are in Florida or in a school that hasn't really done much with distance education, there may be institutions across the country that are helping with best practices for that. To kind of cut to the chase a little bit, Council of Colleges, particularly in the last couple of months since this has reared its head, have been working very closely with the Accreditation Commission for Acupuncture and Oriental Medicine. Their acronym is ACOM. You know, we all love our acronyms. We are CCAOM. Mina and Olga are NCCAOM, and the Accreditation Commission is ACAOM. So anyway, ACOM is what we call them. And we've been working closely with them on how to continue to deliver our curricula while maintaining standards, as I mentioned before. And ACOM has been, thankfully, very, very supportive and expedient when it first became necessary to issue the emergency waivers for distance education. First came the waivers for didactic education. So as you know, many of you went online. We've been using Zoom at my institution. Other places are using Canvas and other technologies to continue to deliver the didactic aspects of education. And then it became clear that it was going to be necessary to figure out how to offer distance education for clinical training. And so ACOM had another waiver process for that. Clearly the biggest question is, how do we deliver clinical education effectively? Each of these waivers comes with an expiration date, and ACOM has been very diligent about updating the expiration date on the waivers as the government continues to promote stay-at-home orders for many states. The number of hours in the distance education for clinical training initial waiver was very limited. And we questioned, as a council, we questioned ACOM on that. And the answer was that the initial wave of those emergency waivers was to get schools through the crunch of trying to graduate students who were right at the end of their clinical training when this hit. So they only gave us basically 10% of our clinical hours that we could offer. And many schools exhausted that really quickly. So we've now been in conversation with ACOM about what is the next step. Now that we're out of the acute phase of this and moving into the chronic phase of this, what do we do? And the good news is that ACOM is very open to working with the Council of Colleges on this very issue. The executive committee of the council proposed increases in all distance education clinical hours, observation, telemedicine, etc. We sent them a letter with our recommendations almost 2 weeks ago, and they've set up a task force that's met several times to review our recommendations. They had a meeting of their full commission earlier this week, and they've promised us a written response by tomorrow. I actually had prayed and hoped that I would have it in my hands by this evening, so I would have good news to share. But what has kind of come through their executive director, Mark McKenzie, who Mina mentioned earlier, is that they think that we're going to be pleased with what the commission has voted. So the executive committee of the Council of Colleges has a meeting tomorrow afternoon, and we will discuss the results from ACOM, and also it's now time for us to start discussing strategies and supporting our member institutions for the safe reopening of school clinics. What does that look like? What do we need? What are different states doing, et cetera? Many states are still going to be there. The colleges in many states will not be able to do anything along those lines until the fall. So again, we're kind of now into the long phase of this. And this conversation about distance education for clinical education during the pandemic situation seems to be moving us into a longer term exploration of distance education in acupuncture education in general. So I believe that, like many things in the world right now, our vision of what acupuncture education is may not be the same after this pandemic. While we all believe that it is crucial to have a large amount of our clinical training be hands-on in person, this pandemic has proved to us the need to be a little bit flexible with delivery methods and what's possible with telemedicine from an acupuncture and herbal medicine standpoint, not to mention dietary therapy and qigong, etc. So while I don't have the approval letter from ACOM, we have asked for a significant increase in the number of clinical hours. And different schools are planning on handling that differently. Some schools are planning on extending the clinical residency. Some schools are planning on graduating their interns and then inviting interns back or graduates back to do additional training. So no one will be left facing practice without adequate training. So just, that's the conversation that we're having, and we're going to continue to have that conversation. Because of the pandemic, we also suspended our spring meeting. We're supposed to be meeting in DC this week. We were going to be having our spring meeting in conjunction with the ASA meeting in DC. We were going to be on Capitol Hill on Monday. But we will be meeting again in the summer once the situation is simmered down. We're still going to have a virtual meeting in the summer. We are asking ACOM to give us a report, hopefully sometime this month, to meet with our accreditation committee and give the full council a report on activities. Again, now it's time for us to be thinking about what is the new normal when it is time to return to work, to help schools be proactive and to be nimble, and then to educate our students on how to do that in their own practices. And before I talk a little bit about the CNT certificate, CNT certification that you need in order to get licensed, I just want to say that from an acupuncture educator standpoint, I really see how in need, in demand, our profession, our medicine is going to be increasingly as people begin to return to work and to less social distancing. We have so much to offer as a medicine that can help both with recovery, as Mina mentioned, but also with preventative medicine. I think the focus in most people's lives on preventative medicine is going to really dramatically increase. So, if you can hold on and stay the course, and we can get you through your programs and get you graduated, I think it's going to be a really exciting future for you. So the last piece I'll talk about before I take questions is about the CNT course. So as many of you know, the council was forced to cancel the CNT course sessions to comply with state stay-at-home orders in order to protect the health and safety of you and the school communities. So the national office has been in constant communication with NCCAOM about this, and with the CNT instructors, and with the students who registered for those courses. The CNT committee has issued some updates that are available on the CCAOM website. So that page, there is a page about COVID-19. So please feel free to go there. Anybody can go to that page. Again, it's ccaom.org. And you can look at any CNT related COVID-19 updates there for the most current information on cancellations, rescheduling, and things like that. So we're committed to assisting students with the completion of CNT course as soon as humanly possible. And that means that as a council with the CNT committee and our subject matter experts, they're beginning to explore the possibility of distance education for CNT certification. So I don't have much information because the CNT committee is working on that kind of as we speak. In the last couple of days, I've had some reports from the CNT committee about the process of working with Pearson View, what's the timeline, what might that look like. So that is my update, and I am happy to take any questions that you might have.
Misti, this is Gayla Gorman. I'm at FCIM. And
I'm sorry, I can barely hear you.
I'm sorry, I wonder which, let me see which microphone it's coming on. Okay, I don't know how, let me see if I can turn it up maybe. Is that better?
That is better. Thank you.
Okay, sorry about that. When did you say you were hoping to have the information from ACOM about the expansion of the clinic hours?
By tomorrow. They said Thursday or Friday. We set our EC meeting for Friday afternoon, and I had just hoped that I'd have it before this meeting. But so hopefully by tomorrow.
And so then as soon as you guys have it, you'll be sending something out proactively to us?
We will share it with the member colleges, but really what happens is once ACOM makes a decision, they share that information. They post it on their website and it becomes the law, basically, right? So I went to the ACOM website right before this student meeting to see if anything was posted, and they haven't posted it yet. Usually they give me and our executive director, whose name is Roberta Herman, they give us a little like heads up, this is coming, we're putting this on the website. So we're just waiting because the commission has already met about this. So hopefully we will have an answer literally tomorrow.
So Ellen and FSOMA are great at updating us. So hopefully, I'm sure Ellen will stay on top of it.
Yeah, if I get it, I will let Ellen know.
Okay.
I probably will email her immediately.
So then my next question is, I was on several weeks ago when most of this material was released initially. And our school has adopted this case studies thing, and just for a little feedback, I haven't been in the program yet, but it has gotten rave reviews.
Yeah.
And you know, from a student standpoint, we actually feel like we're learning more than we do when we're actually in clinic and everybody's rushed and supervisors are like, just use these points kind of thing. Like there's much more interaction. And granted, we need the experience actually putting needles in people too. It's not, can't be 100% that way, but it's really, it's a great blend of the education. And I'm a huge fan of distance learning, so it's been awesome for me. Not everybody is in that same boat, I know, but it would be great to go forward and have a good percentage of the education be able to be delivered online.
Well, you know, I just want to say while you're talking, first of all, absolutely. So that's what a lot of us are experiencing. We've had some really positive feedback from all of our member colleges, particularly around case studies, grand rounds, and around observation. Like having observation through distance education, not in somebody's private practice clearly, but having an instructor either work through a case study and have the students watch that, or have an instructor use a model, someone that maybe that they have in their family circle or something like that.
Oh, I see what you're saying, where they actually have somebody they can show and demonstrate it. Yeah.
And they're learning so much and they're asking a lot of questions. And so that's what we're hearing as an educational community, like, let's keep some of the really excellent parts of this. And the other piece that I would say is that ACOM, the Accreditation Commission, sorry, I default to shorthand sometimes. Okay. The Accreditation Commission already has in their standards, you can apply as an institution for distance education. There is an application for every institution. These waivers that ACOM approved and released to us were for the emergency situation. So there already is the capacity for distance education. We are, as a council of colleges, looking to see, is it enough hours? Because we need to now say, looking at the educational standards, how much of that education can really be done by distance ed? Like, how much is hands-on, how much is distance ed? And that is up to each institution to decide within certain parameters. We as the council can make recommendations to ACOM to say, maybe it could be up to 25% or something like that. I'm making up, I just randomly threw out a number.
Yeah.
But those are the conversations we're having. But please know that every institution has the capacity to apply to ACOM, not in the pandemic situation, but in regular life for some amount of distance education.
So there's my next question then. Our institution in particular, and this is another thing that I picked up from several weeks ago, the town hall, that the institutions that have been really progressive and use electronic medical records have been able to adopt this
That's right.
this distance clinic thing much easier than the ones like our school. We're all still on paper. And so our school, I think, took the position, like you said, that they were really mostly just concerned with the graduating class and trying to get anybody who was close, get those people out the door. But it's left a lot of us who didn't fall into that kind of feeling really far behind now. Like, I feel like I've lost a whole semester.
Right.
We were already low man on the totem pole in clinic for the semester as it was, and then this happened, and now we've basically gotten no clinic hours for this entire semester. And so I'm wondering, what would be appropriate? I've sent emails to asking like why we're not expanding this program so that more of us can be allowed to take advantage of it, because I think the program's awesome, and I feel like I'm really going to lose a lot by not being able to participate in it to a great degree. And so I'm just wondering, is there any appropriate path to prodding our school to expand it within the guidelines of what is allowed by the accreditation? Because that's typically the pushback we get is, you know, we're just operating under the guidelines and there's only so much we can do, and, you know, blah, blah, blah. And so now we know there's a lot more wiggle room.
There may be, maybe tomorrow, maybe by tomorrow, there'll be more wiggle room. And it may be true, because 10% of clinic hours isn't very many. Most schools exhausted that.
We haven't even come close to getting 10%.
Yeah.
You know, like,
so do you,
because our school has to expand that program.
That's right.
At 3 or 4 times what it's doing right now in order to meet the demand.
So it could be that they're hedging their bets and then just waiting to see when they can reopen. Who knows? Like, I know at our institution, we are doing some clinical hours in herbs and some clinical hours through grand rounds case studies. And we are kind of front loading didactic stuff that was coming later in the clinical year, so that when the interns can return, they'll be kind of, you know, guns a-blazing, a bunch of clinical hours with hands-on. So different schools are taking different approaches to this. Some of it may be that the school may be struggling because they don't have electronic medical records, right? You've already said that your school doesn't have that. We have enough of that this is possible. So it could be that they just need some help from some of the other more the schools that have already done this for a while. So my suggestion, and I don't know if your school has this, but do you have, you would most likely have a student dean. And if you have a student leadership group, I would suggest that your student leadership group contact your student dean and your academic dean. And then also, you know, could just say, we would like a clinic hours. We know that this is possible. And we heard that the Council of Colleges is willing to support member institutions to do that. So that would be how I would you know, from an administrative standpoint, not as a Council of Colleges person, like how would you want to hear about that? Probably through your student leadership, through
that got disbanded over the last semester because there just was not enough participation.
Oh, yeah.
And you know, it's just that does kind of help, and I think it will help if ACOM comes out and significantly even expands the number of hours, so that puts them even further behind in delivering what's possible. So it's going to pressure them that they're going to have to do something.
Right, and there are things that they can do without electronic medical records. I don't mean to say that the only way you can do this, like you can't do telehealth without that. That would be really challenging. But there are other things that other institutions are doing that are possible for clinical hours, you know?
Yeah, we're just using the students are the patients basically.
Yeah, right.
And we all like send in a release saying that we're cool with it. And then the patient or the students take turns and doing it in like pods of 4. The program, I was so impressed when they announced it. I'm like, that is so brilliant. And then just a lot of disappointment over the last month because it's been so limited. And, and you know, our class has gotten 4 people so far from our class have gotten 1 session. And they're going in alphabetical order, I guess, because they've got so much demand. They have no easy way to figure out how to prioritize people. So, okay, well, that helps. I'll wait and see if in the next couple of days we get something from Ellen saying that this official word is on ACOM's website, and then I'll have to just figure out how I'm going to put something together that politely pressures them to figure out how to expand it. So, thank you very much.
My pleasure.
I do see some other people here from FCIM, so if you can message each other on the chat and connect, that may give you a little more support, Gayla. Any more questions? We've got a lot of people here.
Ellen, this is Mina. I do see a question about, somebody asked about, and I think we answered it. Can you take the NCCAOM exams in July if you're graduating August 16th? Yes, you can actually start to take the NCCAOM exams on June 16th, 60 days before. So I think we've answered that question. And then there was another question that said, I'm having a problem figuring out how to send my information to the Florida State Board. Also figuring out what information they already have on file. It took 19 days to get an email response and it was not helpful. Not sure if someone here is able to help with that. We do communicate with the Florida State Board. I mean, we obviously have a system to be able to send them verification of examination results so that you can get licensed there. Send me an email or Ellen, let Ellen know, and then Ellen can forward it to me and I can give you my email as well. We could try. Sometimes the boards, for whatever reason, sometimes they're, you know, because of COVID, they're closed, or sometimes they're just backlogged. We try to go ahead and help in certain instances, particularly if it has to do with licensure requirements. We try to, we've helped our diplomates before. So depending on what the information is or what you need, we can try to help on your behalf.
Yeah, I did put a note in. There's a, it's hard to find, so I put the link in to find the board staff, and you can email them directly. And Krista Peace is probably the person to try directly.
Yes.
And if you don't get response from her, email us and we will see what we can do to help.
Yes.
The Board of Acupuncture staff actually covers like 3 or 4 other boards. So they're very overworked. They're very
they are
stretched very thin. And we don't know what their status is with the COVID and staffing. So, but even on a good day, they're pretty busy.
They're very busy.
Strapped.
Absolutely.
Yeah, but that doesn't mean you shouldn't be able to get your information. So,
can I ask Mina a question, Ellen?
Sure.
So what is the possibility that this policy you guys have put in place where you can take boards 60 days before graduation is going to continue? That was one of my biggest
Right.
disappointments from all the new stuff you guys implemented last year.
Right. So as it relates to COVID, we're going to assess that situation. If the COVID-19 situation comes back and it really impacts us as greatly as it has been, you know, at the end of the year, we're going to reassess that and see if we need to extend it. Having it come back permanently, there's a lot of issues with that. And I want to explain this because I don't think previously this was explained very clearly. One of the reasons why we actually implemented this policy is because it did, there was a lot of problems with pre-graduation route. What happened was you had people that would apply for NCCAOM certification. They would take their exams, do all their requirements, and then for whatever reason, they didn't get certified. I don't know if it had to do with just not knowing or not filling the other requirements for certification. And then they would basically continue on. And some of them didn't even realize they weren't certified. And then they would come to us 15 years later and say, okay, I want to go ahead and move from Florida to Virginia that requires certification. We would say, I'm sorry, you're not certified. And they would be devastated. And they said, wait a minute, what happened? I said, this is what you didn't complete. And they would have to start all over again. And sometimes the educational requirements have changed, you know, years after. So it was a very devastating situation, and it happened a lot. So with the elimination of the pre-graduation route, this doesn't happen anymore because you really have to have completed all the requirements, including graduation, in order to be able to take the examinations and be able to be NCCAOM certified. That problem doesn't happen anymore. And there was a lot of people, Olga can tell you because she takes care of our database, there was a lot of people that fell into that category, which is one of the reasons why we're doing the reinstatement route, to get those people to come back. We're actually trying to help them come back. Another reason was because of our accrediting standards. A lot of, we really want, we work with NCCA and we work with our best practices for certification to ensure that we're constantly meeting those high standards, and graduating and finishing your education in order to be certified was a big element of that. So we really took that into consideration before we went ahead and created a route. Now, if we were to do it over again, if I was in charge back when that happened, we would have given some more notice. We would have timed it a little bit differently so that we didn't time at the same time that we did the linear exam. That had a negative impact on the students, and I get it. And it's something that caused a lot of hardship for the students. So if we were to do it over again, we would have timed it a little bit differently. So we wouldn't have had it right after the linear exams. People, it became difficult for them to take the exams. But in terms of eliminating the pre-grad route, eliminating this route completely and going back to that, we're not going to be able to make that happen. We want to be able to really work with our candidates and students to give them that advantage while they're being impacted by COVID. And again, we don't have a timeline exactly when that, right now it's 2020 at the end of this year because that's what we see, but we're going to look at that impact as we're moving further and further into the year.
So with all due respect, I have certifications from different organizations.
Right.
I am a CPA in my former life and took the CPA exam many years ago, and took that exam within the couple of months before I graduated. That's a fairly standard process where lengthy schooling ends in needing to pass an important exam, and how the exam's delivered, that's a different scenario. But it just doesn't seem, I get it that the certification, you guys want to place more emphasis on the certification, and that's important. If somebody was able to get licensed in a state because certification wasn't required, then I get it that a lot of people don't understand the importance of license portability. I do, because I've had license before.
Sure.
But to penalize everybody because some people did not complete the process so that they had license portability, I think penalizes everybody in a way that is not really fair. So.
Well, I understand, and I understand your opinion, and I know there's a lot of people that were upset about the process, and again, we should have given it more time and more public input, but we really looked at, and I know there's professions out there that allow you to go ahead and take exams before you graduate, but it really had to do with the fact that as a healthcare organization, we wanted to make sure that that whole process of certification was completed. And we wanted to be able to really just be able to get that process finished so that we don't have all of these limbos and all these situations where people, it goes through tremendous hardship in order for people to be able to come back after years and years of not being able to, in fact, some of these people actually thought they were certified. That's what they thought. So that's one of the reasons. The other reason, and again, a lot of students and others don't realize, because of that system, our application process and the whole process of approval has been completely diminished to 1 week. And one of the reasons why we've been able to really automate everything and make everything, it used to take weeks and weeks and weeks to get certified because of the pre-grad route. It was, a lot of the information was contingent upon the schools. The schools had to really put it together. There was difficulty sometimes with communication depending on the schools. All of that's been eliminated. And typically when someone applies, within about a week, they should be able to be ready and take that exam. So really that process has been expedited, and students have been able to get in there or graduates have been able to get in there and take the school. Also, it really, I think from the school's perspective, I know some of the schools have there's different opinion on that. There's difference of opinion of schools in terms of whether this route has caused difficulty or not. But we've been really the whole portal system and the communication with the schools have significantly improved since we have implemented this route. So Gala, I understand the frustration. I know this is something that really put some people and some students into hardship. We really want to be able to emphasize the importance of certification, particularly as more and more states do require certification. And we don't want to have, we want to have a consistent standard as well. So I hear you, I understand that, but at this point, we're not going to go ahead and we're not going to be able to go ahead and reverse that permanently.
So just another thing to consider when you guys are noodling on this.
Sure.
So for example, I will be done, or take Kim, for example. Kim's all done.
Okay.
And she, technically, her graduation date, just because of the way FCIM does semesters, we have 2 semesters as opposed to trimesters. So the semester doesn't end until like the 3rd week of July.
Mm-hmm.
Formally. That's like how long you have to finish all your clinic and all that in order to meet those semester requirements. Mm-hmm. But for all intents and purposes, with the exception of a couple of dangling classes that are just finishing out, the whole curriculum is pretty much done by the middle to the end of May, 2 whole months before. Mm-hmm. And so when we have to wait for that whole, for FCIM to say, we can't send anything until everybody hits this formal graduation date, and then we've got to go through all that, we might have been 3 months from actually pretty much being done. So,
right.
So it really drags it out like way longer than it should have to be.
Well, one thing I do want to add, and Olga, correct me, I want to make sure I understand this. I know that when there's a 60-day provision where we allow people to apply before that. Olga, are you there? I don't know if she can hear me. So the way that we have allowed it, Olga, can you hear me?
Yes.
Okay.
Yes, I can.
So can you explain to Gala? I want on the school representatives and the candidates to understand the 60 days that we allow people to be able to apply. Not right now because we're having the waiver, but typically when we have the graduation requirement. Can you explain that to everybody? I want to understand that a little bit better.
It's either now or during regular times. All students are able to apply. Mm-hmm. Right. It's either or. Students are able to apply 60 days before their graduation date. 60 days give them ability to complete the CNT class and request verification of that to be sent to NCCAOM, and request graduation transcripts to be uploaded. By the time we receive the documentation, within 1 week, we approve them to test. So pretty much they can start testing right after their graduation date. So it was done to expedite their testing period as much as possible and to eliminate any delays in application processing.
Right, and that's during normal times. With COVID, they could actually we allow them to come in and test, which they can do. Like for example, in Kim's case, she would be able to, if she's graduating, I don't know when her graduation. Let's say she's graduating August 16th, she can go ahead and start testing June 16th. Doing right now.
Incorrect, Mina. Incorrect. Yeah. June 16, Kim will be able to submit application, and as soon as we receive, as soon as we receive school transcript and a CNT, she will be able to start scheduling her exams, and it may happen June 2021.
Right. So
it's an example.
Right. Well, for example, it also depends on when we get the information. If the school is proactive and sends us a list early, like for example, Kim goes to her school now and says, look, I want to make sure that I'm on that NCCAOM list, and so that I get it, so that we get that list and we know that this is going to be her graduate, this is the time that she's going to be eligible, then we work proactively so that she can go ahead and take that exam. But that's for COVID. Once this is all over with, whenever that is, then we go back to the other process where she can go ahead and apply and begin her process for getting ready to be able to do the requirements before she can test.
Mina, I have a question.
Sure.
For my application, it worked perfectly. You guys sent me the invitation to apply 60 days prior to my graduation date. I applied. Within a week, you sent me the okay to go ahead and schedule test, which I've done. I found spots. They're not perfect spots, but I did find spots here locally in Orlando. After I take that fourth board test and I pass it, is there anything I need to do to get certified with NCCAOM? I mean, because you have like a partial transcript that doesn't include the last couple of classes.
So once you've taken all the exams, right, and you've definitely make sure you get your CNT. So the Council of Colleges, it's very important that they send a CNT over to us. We have to receive it from them. Then the only other thing you have to do in order to actually get that certification is to have your graduation transcript sent from the school to us. You have to do that. So right now during COVID, we're allowing students to be able to take the exam before we receive that graduation transcript. So you want to make sure you finish that. So let's say August 16th is your graduation date, and let's say you've taken all those exams already and you've sent your CNT, and then you want to call your school and say, make sure you send that graduation transcript in. And then once you do that, it's very fast. It's within, because everything again is paperless and automated. Then you'll be able to get certified. You'll get your certificate. You'll get your all of the information that you need in order to get certified. So that's the one thing you have to do. In order to get certified, you have to get that graduation transcript from the school sent to the NCCAOM.
Don't you also need a first aid certificate?
What is that? A first aid?
First aid CPR. Don't you need that too?
That's for recertification. So once you get certified, then you have 4 years to do 60 hours of continuing education, and that's when we need your CPR. So that's after you become certified. That's a requirement. You don't need to do CPR for a certification.
Okay, perfect. Yeah. CNT only took 1 day to get there from them to you.
Yeah, they're wonderful.
You guys are amazing.
Well, it's also, I have to say, Paula Diamond and the Council of Colleges is amazing. We really work well together. We have a system down. Everything is automated. They've really partnered with us in terms of our paperless efforts. So we're a good team.
And I love your portal. You
In
can
the
just
morning I couldn't show. I will share too, and then the morning class I'll share next time.
Oh, thank you, Kim. We appreciate that. Thank you so much.
Okay, well, we've gone a little over, but that's great. I think there was some good information shared. Thank you all. If there are more questions, you can email them to me and I'll get them out and to people, and we will be posting the recording. I'll send it out to everybody that registered later. Thank you to Mina and Olga from NCCAOM. Thank you to Misti from the Council of Colleges. Thank you to all your students. The FSOMA President, Sandra Kahn, VP David Bibby, and our membership chair, Sima, were here joining us, and we really appreciate all of you, and please let us know how we can support you, and thank you so much. All right.
Thank you so much.
All right, thanks. Let's all wave. Bye.
Bye.
Bye, guys. Thank you.
Bye.